Let's do some questions. Let's understand what we have done till now. Regarding investigation of malignant bone tumors, you do a transverse incision. You take a vertical incision. Sample should be taken from two different planes. True. Sample should be taken before any radiological investigation. False. It should be taken from periphery. True. So second and fourth are correct. C, B and D are correct. Question number 2. A young marathon runner is participating in competition. After initial run-up, he has pain in the anteromedial aspect of tibia. Mild to start, but increased on further running. X-ray was normal. Doctor ordered a bone scan. Diagnosis, shin splints. This is classically stress fracture. MRI would have been an option. Bone scan can also be done. X-rays are normal because initially you see marrow changes. What is to be done next? They have shown you a lesion going right till the joint. The joint. What will you do? Biopsy. Tissue is the diagnosis. You could have done an MRI, but that's not in the option. So biopsy. Which investigation is best for estimation of bone age? When you want to estimate the bone age, you can take the X-rays of hand and wrist. X-rays of vertebra are not to be preferred. CT scans are usually not preferred. Ultrasound is not preferred. So simple X-rays of hand and wrist can help you decide the age. Name the joint that ossify around 16. So we remember that what looks down is finishing early. So you have the ankle, you have the elbow and the hip. So hip, elbow and the ankle. These are 3 joints that ossify at 16. Left to right movement of the skull occurs at the atlantoaxial joint. We did this. Atlanto-occipital, say yes. Left, right, no. God has made us like that. We first associate yes, then no. We are positive, positively made. Type of fracture according to the Salter-Harris classification, type 2. So you can see type 2. Identify the most probable age of the child under the POSCO. When you look at this image, you should remember that the scaphoid ossifies at the age of 5. So you can see scaphoid. So 4 years is out. Since all the carpal bones are not there, the last carpal bone to appear is pisiform. So the age cannot be 13. So now you have 7 and 10. Right? And if you have to choose, the scaphoid appears with trapezium and trapezoid. So you have scaphoid, trapezium and trapezoid. Right? Capitate, hamidate are already there. Scaphoid, lunate and triquetral are there. So if you have to choose between the two, 7 and 10, choose 10 years as the answer because you have majority of the bones coming up. Except for pisiform which couples at 12 years. That is why your answer is going to be 10 years. Which investigation is not useful for evaluation of osteomyelitis? You do cultures, very important. Bone scan can be done. X-rays can be done. MRI can be done. CT scan can be done, but is the least preferred one. So is the answer. Which bone does not form the wrist joint? Wrist is the radiocarpal joint. Ulna is not a part of it. 14-year-old male, overweight. From the endo is referred to the orthopedics department in the emergency with a painful limp. Whenever they talk about limp, think about X-mass. X-ray, MRI, aspiration. Aspiration, ultrasound guided. So X-ray, MRI, aspiration. So answer is CT. Usually not done in children. High radiation exposure. Ortho is more about MRI. The earliest radiological sign in Pott's disease means TB spine is loss of curvature. Since that's not there, narrowing of the disc space is the second best. The earliest bony change of osteomyelitis on X-rays. The earliest change of osteomyelitis on X-ray is loss of soft tissue plane. But here they have asked the bony change. So the answer will be periosteal reaction. A 4-year-old girl has fever, thigh swelling with a mass. On X-ray, You have a periosteal reaction. X-ray has been done. Bone is destroyed. Next investigation. Next is MRI. Not given, I'll not wait. I'll go for biopsy. In case of suspected septic arthritis, best way to confirm tissue is diagnostic. X-ray, MRI. But best is tissue, so aspirate, do cultures. Investigation of choice for stress fracture, ortho is all about MRI. Sun ray appearance in osteosarcoma, periosteal reaction. Screening tool for hip instability. Screening is ultrasound. Investigation of choice, MRI. So this was our chapter 1, lecture number 1. Thank you very much.